Hello, everyone, and welcome back to the Digital Health Wire show. My name is Jason Berry, and I'm the editor of Digital Health Wire. And I'm excited to be joined today by Blake Walker, who is the CEO of Inbox Health. Blake, it's good to see you.
Jason, thanks for having us.
My pleasure. Blake, Inbox is an exciting new company, but for anyone who is unfamiliar, could you start with a mile-high overview of the company, the mission, and who we're helping?
Absolutely. Yeah, not too new. We've been around 11 years. Believe it or not, we are a patient billing communication platform working with about 3,500 practices, largely in the ambulatory market. So we integrate with about 25 different electronic health record platforms and then pull out all the patient data after insurance adjudication is complete, and then use algorithms and data to drive the most efficient and effective patient communications for patients that have balances after service. So think about sort of the old fashioned, send a statement to the patient, 3, 4 weeks after they come to your office. We're replacing that, with omni-channel communication using a combination of text, email, and paper mail, automated voice calls, and really automating everything that has to happen to reach a patient after their visit. And we've kind of taken a step further than that and try to address all the questions that patients have after the visit about that bill. And I think most people who have been a consumer of healthcare in America know that healthcare bills are really confusing. Most of us have questions, including myself, when I get a bill. And it can be really difficult to actually get answers to that. So our company has really built a suite of communication tools that help patients better ask questions and engage with the billing teams that can answer and support the patient and get those questions answered. So yeah, it's a big problem in the U.S. About $500 billion a year being paid by patients to their healthcare providers now. Super unaffordable, super frustrated, friction-filled process. So we've been, working as hard as we can for the last, 10 years or so to try to make this as frictionless and efficient a process as possible for the providers and the patients that they're serving as well.
Yeah, the medical billing experience. Frictionless isn't the first word that comes to mind for most patients out there today, so there's a lot of room for improvement there. What are some of the different solutions, the levers that you guys are pulling to kind of remove some of that friction and solve some of these problems?
Yeah, I mean, I think the reality starts with, are we getting paper bills a month after our service? Like we really want to reduce the time that between the visit and when the patient gets that notification that they have a balance, so that there's not this space of weeks where, you almost forgot that you even went into the office. That's a huge part of it. I think that the other one is like when I want to understand that bill, like how do I get that answer? If you pick up the phone and call the practice, does someone answer at all? If does the person that answered the phone actually have the information that I need to get clarity on it? Are they just sort of dismissive of my concerns? Affordability is a huge concern. So like for us, like having all those tools to be able to make it really easy for the support staff to answer those questions about the bills, make sure that patients can get them, make sure that that support experience can be digital. I think most of us don't want to pick up the phone to have that conversation. We want to be able to chat. We want to be able to text and get the answers that we need. So we want to equip the practice and the patients to have those conversations digitally. Um, and affordability is a huge component of friction in this space. So like when patients have large balances, are they able to get access to payment plans? So we build products that really meet all of those different needs, where like the two main problems facing a patient is like, do I understand the bill and believe it was accurate? Like, can we resolve that friction point? And then the other is affordability. Can we resolve the affordability friction point for a patient? So if those are the two main concerns, that's really the two concerns that we're focused on tackling head on with our products.
And I saw that you recently rolled out some platform enhancements that are kind of right up that alley, helping your agents tackle these problems as early as the first touch point. Can you kind of walk us through the new enhancements, how you're weaving new tech into the platform to make all that possible?
Yeah, there's really two big enhancements that we've made over the last year. The first one goes back about a year where we launched a services team that practices can use to enhance their own team. So when they have these tools like real-time chat, they might not be that well equipped to actually use real-time chat to answer patient questions. They can engage with our services team to help add more throughput and resources to their existing staff in the office. I think staffing is a big challenge for a lot of practices. So when they're trying to help patients get access to real-time chat answers to their questions, they can rely on our team to do that. The second really exciting one for us is AI. We've done a lot with machine learning over the years in the patient support ecosystem. AI has been obviously really hot, largely driven because large language models have really enhanced our ability to communicate in very human ways. Um, and over the last 4 or 5 months, we've been training a large language model to be able to basically digest everything that we know about a patient and then provide the human agent with the correct response to any patient question. So if a patient comes in and they really want to understand, why they had a balance after their visit, and the human agent before this would have had to go through each claim, review how it was billed, review the insurance payments, review the pay reasons codes that came back from the insurance, and really try to figure out all the details, all the steps that would happen. Now we have the AI that can kind of go through and within a second basically provide the agent with the answer and say, hey, this patient had a deductible that applied. Then they hit their out-of-pocket max, but then they had co-insurance that impacted it. So it can really kind of speed up the process for that human agent and make it far more efficient. Um, and this is extremely high success rate. So like the AI agent can do a really good job of sort of informing the human agent's answer to almost any question at this point, and has access to all the patient data to do so.
A lot of these like medical billing inquiries must be super complex. I picture it as taking an average of, I don't know, a dozen touch points to get through these. What's kind of the average patient journey, if there is an average one, look like to resolve this? Is it something that we can tackle in a handful of calls or less than that or more? What's that look like?
Yeah, I mean the typical situation in the industry right now is multiple calls, right? Like you're calling in, and the problem that you usually have is that you can't get the right agent on the phone the first time, and someone has to call you back, and that's sort of your starting point. And then a lot of times the people who are doing the first line support don't have access to the billing information. You have to kind of work through a different system, and it is a multi-touch point process. With this situation, the human agent plus the AI sort of empowering them gets you through any question that you need in the first touch point. With sort of the caveat being like a lot of support interactions where patients are engaging with a billing support situation
Mhm.
results in things getting rebuilt to insurance, right? And so then you have to kind of go through that insurance adjudication process a second time. But any sort of basic question a patient might have, doesn't really matter how complex it might be. The human agent can very, very quickly get the answers that they need through the AI enablement of the system.
Nice. And it seems like right now is definitely the time to be equipping these patients and these teams with as much support as possible. I saw that Gallup recently put out a survey that American consumers borrowed about $75 billion to pay medical debt last year. On top of that, the new administration has a lot of things in limbo, but the Consumer Financial Protection Bureau also recently just got shuttered. So when patients are borrowing money to pay their bills, they don't have the CFPB to turn to. I imagine there's a lot of inbound questions that they're looking to get answered. Why was now the right time to launch this? And can we even forecast where this space is heading over the course of the next year?
Yeah, I mean, I think for 20 years, patient billing has become a bigger and bigger problem that's sort of snowballed. And then you have sort of the politics of patient billing complicating it further. The CFPB has played an interesting role. About a year ago, they changed the thresholds for credit reporting for medical bills to $500. That was sort of the first foray they made in a really serious way into like how patients thought about medical bills, and that was a big change, right? We saw immediately, about a 5% decrease in patients' likelihood to pay a medical bill when that first change came through, which I think is super interesting. And then more recently, just a couple months ago, the CFPB, right before the administration change, went and made it so that you couldn't report any medical bills to a credit bureau. And so that could be a good thing for consumers for sure. It's certainly a challenging thing for providers, where the providers are thinking about, how do I, profitably run a practice where 30% of my revenue is sourced from patients, and they don't technically have to pay. It's really hard to sort of enforce that now. So it's a really complicated situation. So as you pointed out, I'd say the CFPB technically still exists as of this moment, but I don't think any of us really know what will happen with it over the next year. But I think certainly it's likely that a lot of those rules would be rolled back in some form. Um, which I think from a patient's perspective, it's just layers of confusion. You can go on Reddit and like read subreddits of like basic patients like talking with each other about like, do I actually need to pay this? And they're all like arguing with each other about it. And the answer is like, I mean, yeah, you kind of do, but you could probably get away with it. Is basically the answer. But I think for providers and patients, like this is a huge challenge, and so like there was no wrong time to build this for the last 20 years. But the need for better patient support solution has just been ratcheting up and up and up every year. And I think at this sort of inflection point that we have with AI just getting better and better because of the advances we've had with large language models over the last few years, it's just become a really exciting time for how these two things can intersect to get something that really creates a lot of efficiencies for providers and gets the consumers a much better experience. Because like getting an answer to a patient question is really hard to get a good answer and to get the right answer to the point where most patients just give up. So be able to empower the provider to really easily answer those patient questions accurately, but also empower the consumer with like the ability to actually get a correct answer almost instantaneously and without actually picking up the phone. It's really exciting, and I think it's really the tip of the iceberg in terms of like where this can go over the next 2 or 3 years in terms of the next few steps of additional enhancements that you could make to how patient support is done.
If this is just the tip of the iceberg right here, what is kind of the next layer of that 90% of the iceberg that's just under the water, that big AI iceberg that's coming our way? As far as your own platform in an inbox, what are some of the things that you're excited to roll out further, help the patient experience and help these providers help their patients with their financial problems?
Yeah, I mean, we have two big things. One for us is the pre-visit patient experience. We really want patients to better understand their costs and coverage, their benefits, and get the payment process started in the office. Do more education of the patients before they actually get to the point where they get the bill later, and have that happen before the visit. The other big one is how much further we can push AI patient support. I think we're at this point now where human agents are deeply involved in every single step of the process, which is important, but it's also limiting to some degree, right? Because humans are expensive and they sleep and things like that. Um, I think what's exciting is how much potential we think there is for our AI agent to kind of expand its role and its capabilities to not just answer questions, but to take actions and to help resolve issues. Like if I need something to be rebuilt, right now that's going to have to be a human agent that gets involved. If it has to go back to insurance, we have to collect more information. Like, can we get the AI agent trained to do that? Can the AI agent be trained to set up a payment plan, et cetera, et cetera? I think there's a lot in the next 6 months, even that we're going to see gradually expansion of the role of AI in the support ecosystem. And in RCM more broadly too. I think there's a lot of really exciting things. But I think for us, for where we're focused on sort of the patient payment, patient support dynamic, I think we're really, really excited about how patient support can evolve with AI over the next 6 or 12 months, even.
And from the outside looking in, it really does seem like this space is evolving so quickly and bringing on new technologies so quickly. Do you think that these billing processes on both sides will even be recognizable in 2 years, or will we be in a whole new world of patient financial billing management?
I think they will be recognizable. I think from the consumer's perspective, I think what you'd want to see from a consumer perspective is less mistakes, far more efficiency, more transparency at the point of care, and just a better consumer experience overall. I think the digitization of the experience will accelerate, partly because of AI, partly because it already was. And I think in many ways too, just like gradually increasing freedom of information from EHR to external systems through loosening of API rules, over the last 3 years. But I think that'll accelerate as well, and I think partly because of AI empowering additional interoperability. Uh, I think on the provider side, I think we'll see it. It'll seem more different. I think particularly, from sort of the scribe to EHR to billing sort of workflow. I think there's a lot of efficiency gains that'll happen in those steps of the process, and then sort of for our part on the patient side, you know, getting to a point where it's largely autonomous, including the support side of things, where that's a huge drain on staffing, it's a huge drain on morale, it's a huge drain on the patient experience. But to see that become, you know, much more autonomous, much more digital, much more of a consumer-oriented experience. I think all that is coming. So yeah, I think it will look very different on both sides, but I think at the end of the day, I think there'll still be that, I go to the office, I pay something, I leave the office, I get something after. I don't think we'll get to real-time claim adjudication very soon, where that like is all happening in a sort of one transaction. I think you'll still have that sort of before and after situation for quite some time.
All right, so the instantaneous billing resolution may still be a ways out, but it really does
I
seem
think we
like
got a
we're
while.
moving
Yeah.
we're moving in a more frictionless direction, though. That's one thing that's for sure.
Yeah.
So it'll be really awesome following along. I'm excited to see the work that Inbox is doing to move us in that direction. Blake, thanks for coming on the show and walking us through where we're at and where we're going. I appreciate it.
Thanks for having us, Jason. Good to talk to you.
All right, everyone, that's been the Digital Health Wire show. Thanks for tuning in, and we will see you next time.